What if your body has been trying to warn you about diabetes for months, maybe years, and the warning has been sitting right there on your feet the entire time, long before any blood test could catch it? By the end of this video, you're going to look at your own feet completely differently, and you may never look at a simple ache, a cracked heel, or a cold toe the same way again. Most people assume diabetes only shows up in a lab result. You go in for blood work, you wait for the call, and that's the moment you find out. I understand why people believe that because for years, that's what my own patients believe too. I'm Dr. William Lee, and I've practiced medicine for more than 20 years. What I've learned, what I see confirmed in my exam room nearly every week, is that your body starts sounding the alarm on high blood sugar long before any lab ever will. And the very first place it speaks up is your feet. I'm making this video because of how many patients I've watched walk through my door, or worse, get wheeled into an emergency room, carrying warning signs for months or even years without knowing what they were looking at. That changes today. Just last month, I sat down with a retired gentleman, 67 years old, active, otherwise healthy, feeling completely fine. He came in for a routine physical. Before we drew a single vial of blood, I asked him one question about his feet. He told me they'd been a little numb lately, and he figured it was just getting older. He had 4 of the 9 signs I'm about to walk you through. His fasting blood sugar came back at 214. He'd been diabetic for over 2 years and had no idea. So today I'm going to show you exactly what I showed him. 9 signs that are already visible on his feet and on millions of feet across this country that almost nobody recognizes for what they really are. For each one, I'll tell you what people usually assume it means, what's actually happening underneath, and one simple daily habit that can protect you. According to the American Diabetes Association, roughly 1 in 5 Americans living with diabetes doesn't even know it. That's over 8 million people walking around right now with a silent condition quietly damaging their nerves, their kidneys, their vision, and yes, their feet. Here's the encouraging part. A $12 blood test can catch this early. But first, you need to know what you're looking for. Let's get into it. The first sign is something nearly every one of my patients has felt at some point, and every single one of them has found a reason to dismiss it. That tingling, prickling, pins and needles feeling in the feet. I hear it constantly. My foot just falls asleep sometimes. I was probably sitting funny. And sure, that happens to everyone occasionally, but I always ask the same follow-up question. Is this happening often without any obvious cause? If the answer is yes, we need to talk. Frequent, recurring numbness or tingling in the feet, what doctors call peripheral neuropathy, is one of the earliest markers that blood sugar has been running high for a while. Extra sugar circulating in your bloodstream slowly attacks the protective outer layer of your nerves. It happens gradually, which is exactly why almost everyone misses it. Here's how I explain it to patients. Picture your nerves as electrical wires, each one wrapped in a plastic coating that lets the signal travel cleanly from your brain down to your foot. When blood sugar stays elevated, it acts like an acid slowly eating through that coating. The wire still carries a signal for a while, but it starts arriving garbled. That garbled signal is the tingling you feel. The American Diabetes Association reports that peripheral neuropathy affects close to half of everyone living with diabetes, making it the single most common complication. And it almost always begins in the feet. That means tens of millions of people right now are feeling this exact tingling and writing it off as nothing. Don't be one of them. For every patient over 60, I recommend a 20 to 30 minute walk daily. Not a jog, just a steady walk. Movement is one of the best tools you have for keeping blood flowing to your feet and protecting those nerve endings. And start cutting added sugar from your diet today, not next month. The second sign is one my patients describe as the hardest to live with because it doesn't show up during a busy day full of distractions. It shows up at night, alone, trying to fall asleep, with nothing else to think about. Plenty of people blame it on being on their feet all day, or summer heat, or plain exhaustion. And sometimes that's exactly right. But when someone tells me their feet feel like they're on fire, especially once they lie down at night, I take that seriously. Burning in the soles of the feet, particularly after dark, is a textbook early symptom of diabetic nerve damage. Here's what's actually happening. Nerves in the feet that have been damaged by excess sugar start sending faulty signals to the brain. Your brain registers heat even though nothing hot is anywhere near your foot. The nerves are simply misfiring. Think of it like a smoke detector with a broken sensor. There's no fire anywhere in the house, but the alarm keeps going off anyway because the sensor itself is malfunctioning. Your nervous system is doing the exact same thing. That burning sensation isn't coming from outside your body. It's coming from damaged nerve tissue crying out for attention. Research published in the journal Diabetes Care found that burning foot pain is often one of the very first symptoms reported by patients who go on to be diagnosed with type 2 diabetes, sometimes surfacing 1 to 3 years before the official diagnosis. 2 habits help here. Drink at least 8 glasses of water daily, since proper hydration supports your kidneys in flushing excess glucose and helps nourish nerve tissue. And build more fiber into every meal, vegetables, legumes, oats, since fiber slows how quickly sugar enters your bloodstream, which is exactly what stressed nerves need. Sign number 3 is the one I need you to really absorb, because this is where discomfort turns into genuine danger, and it's the one that sends the most patients straight to the emergency room. They'll tell me, "Doctor, I got a little blister from my shoe 3 weeks ago, and it still hasn't closed up." They waited, assuming it would heal on its own the way it always had. Most minor wounds do heal by themselves, but not when blood sugar is running high. When glucose stays elevated over time, your body's ability to heal efficiently breaks down. Blood vessels throughout your body, including the tiny ones supplying your feet, begin narrowing and stiffening. That means oxygen, white blood cells, and the nutrients responsible for repairing tissue simply can't reach the wound fast enough. The wound just sits there, open and vulnerable. Picture trying to water a garden with a hose that's badly kinked. The water exists, it's just not reaching where it needs to go. That's precisely what elevated blood sugar does to circulation in your feet. Everything your body needs to heal is present in your bloodstream. It just can't get through. And an open wound that refuses to close is an infection waiting to happen. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in America, over 100,000 every year, and nearly all of them started as a small wound that got ignored. Tonight, after your shower, sit down and inspect both feet carefully. Check between every toe, check your heels. If you spot any cut, blister, or broken skin, clean it gently with mild soap and water, apply an antiseptic, and cover it. If it hasn't improved within 48 hours, call your doctor. Not next week, 48 hours. Sign number 4 hides in plain sight. Most people walk past it every single day without ever realizing what they're actually seeing. Patients notice their feet turning darker or taking on a reddish tone, and they assume it's sun damage or just how their skin has always looked. Sometimes that's true, but there's a specific pattern of discoloration, especially around the ankles, that I watch for when I'm assessing blood sugar risk. When circulation is compromised by high blood sugar, the lower legs and feet stop receiving enough fresh, oxygen-rich blood. The skin changes color. Another signal that the tissue isn't being properly nourished. I explain it to patients this way. Think of your blood as a delivery truck carrying oxygen and nutrients throughout your body. Your feet sit at the very end of the longest delivery route you have, farther from your heart than anywhere else. When the roads narrow because of damaged blood vessels, deliveries stop arriving on schedule, and the skin, starved of fresh oxygen, changes color right in front of you. A study in the Journal of the American Academy of Dermatology found these skin changes are typically visible about 18 months before a formal diabetes diagnosis. The daily habit here is simple: 5 minutes of ankle circles, toe raises, and calf stretches each morning. Even that small amount of movement helps push blood into your feet. If exercise isn't an option, elevating your feet slightly while seated can still make a meaningful difference. Sign number 5 catches my patients off guard more than almost any other because it looks so completely harmless. Most have lived with it for years without ever connecting it to blood sugar. My heels crack every winter. They tell me it's just dry skin. And that's an extremely common, ordinary thing. But when heels are cracking badly in the middle of summer, or no moisturizer on earth seems to help no matter how much you apply, that's a very different story. Diabetes affects the autonomic nerves, the ones responsible for automatic bodily functions you never consciously think about, including regulating moisture and sweat in your skin. When those nerves sustain damage, the sweat glands in your feet stop functioning properly, and your feet lose moisture from the inside out. No amount of lotion can fix a problem originating that deep. Picture your skin as a brick wall that depends on solid mortar to stay sealed. When those autonomic nerves are damaged, that mortar begins crumbling, and cracks start to appear. Those cracks aren't just cosmetic, they're open doorways for bacteria and infection. And in a foot with poor circulation already, an infection can escalate quickly. I've had patients arrive with heel cracks so deep they were bleeding after 2 full years of applying lotion with zero improvement. That was never a skin problem, that was a nerve problem. The American Podiatric Medical Association identifies chronic, treatment resistant heel cracking in seniors as a meaningful indicator of autonomic neuropathy, a condition directly tied to long term elevated blood sugar. And autonomic neuropathy is never a minor inconvenience. It's a sign your nervous system is under real strain. Moisturize your feet every night before bed. A good lotion or pure coconut oil works well, applied generously to the sole and heel, though never between the toes, since trapped moisture there invites fungal infection. And keep drinking those 8 glasses of water daily. Your skin needs hydration from within just as much as from the outside. Let's pause here for a moment. We've covered 5 signs so far, and I want to ask you something directly. Have you noticed any of these in yourself or in someone you love, a spouse, a parent, a sibling? If the answer is yes, even to just one of them, go to the comments right now and type the word yes. That's all I need to see. I read every comment on this channel, every single one. So if you have a question, ask it. And if something's worrying you, tell me. That's the entire reason I built this channel, not to talk at you, but to talk with you. And if this has been useful so far, tap that like button now. It takes 1 second and it tells YouTube to put this in front of more people who need to see it. Let's keep going. Sign number 6 is more serious than most people assume because it isn't only about your feet, it's a signal about your kidneys too. Almost everyone I've seen with this tells me the same thing. I sit at a desk all day, or I'm on my feet at work. Some swelling is normal. An occasional swelling from activity absolutely is normal. I want to be clear about that. But if your feet and ankles are swollen consistently, leaving deep sock lines every single evening, that's a different picture entirely. Elevated blood sugar damages the kidneys over time. And your kidneys are what control your body's fluid balance. When kidney function is compromised after years of high glucose, fluid starts collecting in the lowest part of your body, your feet and ankles. This swelling, called edema, signals that your body's filtration system is under real stress. Think of your kidneys as the water treatment plant for your entire body. Every drop of blood passes through them to be filtered clean. When high blood sugar damages those filters, the system backs up, and excess fluid has nowhere to go but down, gravity pulling it straight into your ankles. Press a finger into the swollen skin, and if the indentation lingers for a few seconds, that's called pitting edema, and it's not something to brush off. The National Kidney Foundation reports that diabetic kidney disease affects roughly 1 in 3 adults with diabetes, and swelling in the lower legs is frequently the very first visible sign that kidney function is slipping. When resting, elevate your feet a few inches above heart level to help pull fluid back towards your core, and cut back on sodium since salt causes your body to retain water and makes swelling noticeably worse. Read labels carefully. Plenty of canned and processed foods are loaded with hidden sodium. And if swelling is new, persistent, or getting worse, bring it up with your doctor at your very next visit. Don't let it wait. Sign number 7 is the one I see misdiagnosed most often, especially in men who often live with it silently for years before learning what it actually is. The majority of my senior patients are male, and nearly every one of them tells me the same story. I've been taking ibuprofen for foot pain for months. I figured it was arthritis or maybe an old sports injury flaring up. I've heard some version of that dozens of times, and sometimes it genuinely is arthritis. But sometimes the pain has an entirely different source, one that ibuprofen was never built to touch. When nerves sustain damage from chronically high blood sugar, they don't always go silent. Sometimes they become overactive instead, firing random, intense signals that your brain interprets as severe pain. Patients describe it as stabbing like an electric shock or a hot needle driving through the foot, and it tends to strike hardest at night when there's nothing else to distract from it. Picture a car alarm that got knocked loose in the fender bender, screeching every few minutes for absolutely no reason. Nobody's breaking into that car. The alarm itself is simply broken. A damaged nerve behaves the exact same way, sending panic signals to your brain when nothing is actually happening. The pain is completely real, but its origin is nerve dysfunction, not injury. And taking ibuprofen doesn't repair a damaged nerve, it only mutes a message your body is desperately trying to deliver, which is the last thing you want to do when your nerves are asking for help. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects roughly a quarter of people living with diabetes, and it's frequently mistaken for arthritis, tendinitis, or ordinary age-related joint pain. Each morning, spend 5 minutes gently stretching your feet and ankles before getting out of bed, flexing your feet, circling your ankles, gently pulling your toes back to get blood moving before you put weight on them. And each night before bed, give your feet a gentle massage, light circular strokes along the sole and up toward the ankle. Your nerves will thank you for it. Sign number 8 tells me exactly how far things have progressed, and when I see it, I know the damage isn't in its early stages anymore. Almost every patient's first reaction is the same. Doctor, I've had cold feet my whole life. My spouse has been stealing the electric blanket for 30 winters. I laugh right along with them, but then I ask a different question. Are your feet still cold in July? Cold underneath 3 blankets? That's when it becomes a real concern. Cold feet that persist no matter the temperature around you. Cold in the middle of summer. Cold under heavy blankets. Cold while the rest of your body feels perfectly warm are a strong indicator of significantly restricted blood circulation in the lower legs. Your blood vessels have narrowed or stiffened to the point where warm blood simply isn't reaching the tips of your feet in sufficient volume. Think of your blood vessels like the pipes running a heating system through every room of your house. When those pipes narrow from years of blood sugar damage, heat never quite makes it to the farthest room, no matter how hard the furnace works. That cold has nothing to do with the weather outside. It's about the pipes inside. The American Heart Association identifies peripheral artery disease caused by narrow blood vessels as affecting more than 8 million Americans, with diabetes standing as the single biggest risk factor, and cold feet are one of its earliest, most consistent symptoms. The best response is a brisk 30-minute walk daily, not a leisurely stroll, a purposeful walk with your arms swinging, which forces circulation into your feet and lower legs, strengthens blood vessel walls over time, and can even help reverse some early narrowing. If 30 minutes feels like a stretch, start with 10. What matters most is starting today. Sign number 9 is the one almost nobody ever talks about, the one I've never once seen printed on a patient brochure, the one most people, and even some doctors, walk right past without a second glance. But once you know to look for it, you'll never miss it again. I rarely have to bring it up myself because patients almost never notice it on their own. During a foot exam, when I look at the lower legs and the tops of the feet, sometimes there's a visible patch of missing hair. The patient glances down and says, I never even noticed that. And that's exactly the problem. It's quiet, it's easy to overlook, and it matters far more than people realize. Hair follicles depend on a steady supply of blood and oxygen to keep functioning. When circulation is significantly impaired by long term elevated blood sugar, the follicles in your feet and lower legs gradually stop receiving what they need, and over time, they simply stop producing hair at all. That patch of missing hair is a visible marker of blood vessel damage that, in many cases, has been quietly progressing for years. Picture hair follicles like small plants in a garden bed. When the irrigation line narrows or clogs, the plants don't wither overnight, they just gradually stop growing. That absence of growth is your body's way of showing you, in plain sight, exactly how your blood vessels are holding up. Research published in the journal Diabetes, Obesity, and Metabolism found that hair loss on the lower legs correlates strongly with peripheral vascular disease in diabetic patients, a reliable sign that physicians are specifically trained to watch for during an exam. Right after this video ends, take a look at your own lower legs and the tops of your feet. If the hair there is noticeably thinner than the rest of your leg or missing altogether, don't dismiss it as nothing. It's one more piece of a picture your body has been quietly painting for a long time. That's all 9. Tingling and numbness, nighttime burning, wounds that won't close, unusual skin discoloration, heels that crack no matter what you put on them, swelling that leaves sock marks, pain that ibuprofen can't touch, feet that stay cold in any season, and hair that quietly stopped growing. None of these are random. Each one is your body speaking a language most of us were never taught to understand, and every single one of them can show up long before a blood test ever would. Here's what I want you to do starting tonight. Look at your feet the way you'd look at a dashboard warning light. Not something to ignore, but something worth investigating. Ask your doctor for a simple fasting blood sugar test, the same $12 test that told my patient the truth about those 2 silent years. Build in the small daily habits we've talked about today, the walking, the hydration, the fiber, the nightly foot check, because none of them are complicated, and every one of them protects the nerves and blood vessels you're depending on for the rest of your life. If even one of these 9 signs sounded familiar, don't wait for a symptom to get worse before you act. Talk to your doctor this week, not next month. And if this video opened your eyes to something you never connected before, hit that like button, subscribe so you don't miss what's coming next, and leave a comment telling me which sign surprised you the most. Share this with someone you love who needs to hear it today. Your feet have been trying to tell you something for a while now. It's time we finally listened.